96.7 WCEI, thanks to you for waking up with us this morning. We have a special guest on the line. Want to welcome Ken Kozel, CEO of University of Maryland Shore Regional Health. Hi, Ken. Thanks for joining us.
Good day, Matt, and hello to the audience out there. Thank you for having me.
I'm just imagining how much stuff you guys have going on. First off, I want to say thanks to everyone at your various locations for all the work being done. Very stressful, I'm sure.
Thank you, Matt. It is, but we have an outstanding team of 2,500 team members. Our medical staff is phenomenal, and we're all working on behalf of the patients and the community we serve. Couldn't ask for a finer group of professionals.
Let's talk a little bit about some of the things that you want to pass along. Tell me what's happening at Shore Regional Health related to COVID-19 right now.
Yeah, so thanks, Matt. I appreciate that question. And I think it's important for the audience to know that one of the first things hospital systems like Shore does during COVID-19 was really to establish our hospital incident command structure. That's a structure that we're very familiar with because we use it in disaster-like situations. And when we establish that command center, it starts with identifying our command leader, our incident command leader. And for us at Shore, that's Dr. Bill Huffner, our chief medical officer. And he helped us establish that command center early on in March. And once we did that internally, then what we do is we work very closely with our emergency operations centers of the 5 counties of the Mid-Shore, because they're doing something similar. They're also establishing their incident command centers, and the positions are the same. The information sharing is the same. So with both of those structures set up, we can communicate very effectively and very easily with each other throughout this pandemic. But the big advantage to Shore this time around is that we've got the partnerships with the University of Maryland Medical System. And the medical system also established an incident command center for all 13 affiliate hospitals within UMS, which Shore is part of. And that has had such a dramatic effect and a positive effect on our healthcare system, because now we've got a centralized command center that can help us manage through this crisis together. So that's the foundation of what we've been doing and what we've been working on. But in addition to that, we've started to use CDC guidelines, policies, and procedures that have come down from the command center at UMS that really help us be safe. And it starts with implementing things like universal masking and temperature taking at all of our facilities. For example, even though everyone's aware of our hospitals and our emergency center in Queen Anne's, we've got doctors' offices, we've got lab draw stations, and other parts of our system that also have to have these measures in place. So we're taking temperatures at all of those facilities and wearing masks at each one of those facilities as well. We've also implemented patient safety policies, which means, for example, that things like inpatients, there are no visitors allowed for inpatients except under very specific circumstances, and by prior approval from the physician administrative officer. For outpatients, each patient may be attended by one person, so we're putting those restrictions in place to help keep everyone safe. We've also canceled all non-essential medical services, such as elective surgeries, routine checkup appointments, and non-urgent lab and radiology procedures until further notice. In many cases, patients may be seen by their providers via telemedicine, and we're encouraging them to call their provider's office to see if that option's available and to make arrangements. In addition to those things, we've made physical alterations to some of our units and within our hospitals, including ventilation system changes that allow us to increase our capacity for isolation and infection prevention. And most importantly, I believe, we've completed a detailed surge plan that enables us to double our overall bed capacity and quadruple our critical care beds. So I think within Shore Regional Health and our 5-county healthcare system, we're in fairly good shape. And while we are likely to experience a surge in our communities with our patients, I'm optimistic that we'll not reach our full surge capacity.
We spoke with Dr. Huffner when this first started, and some of those beginning stages of those changes were being put into effect, but this has just been nonstop and constant. And you guys, I can tell by trying to reach out and talk to you, that you're always looking at it and planning and being ready to make changes necessary.
You're absolutely right,
Yeah.
Matt. You've got to be 3 steps ahead
Yeah.
with these pandemics. And again, thanks to University of Maryland Medical System and their incident command structure, they are at the seat of the table when they're talking about measures that we can take to keep our communities safe. So very important relationship there.
You mentioned earlier, I think you said 2,400 workers. It's got to be, I can only imagine how challenging it is to be working in healthcare right now. So as you take the figurative temperature of everybody, how are the doctors, nurses, and other staff members holding up?
I appreciate that question, Matt. What a lot of people might not be aware of is that pretty much everybody that works in our healthcare system is deemed an essential employee.
Yeah.
And that just means that we're at work doing our jobs. And there are staff, though, who have desk jobs that are working from home still. Providers, nurses, techs, environmental food service team members, facilities, maintenance, you name it. All of the personnel that we need to run the hospital system is on site doing their jobs and taking great care of our patients and supporting each other as best they can. What's also interesting is these times like during COVID really cause us to be nimble with how we run our healthcare systems. So some of our team members are working in different capacities than they normally would. So at times you can have a nurse who normally works in cardiac rehab department.
Yeah.
They may be posted at the emergency entrance to take temperatures for our team members and visitors and patients coming into our system. Physicians who might normally do surgery may be rounding on hospital units, caring for non-surgical patients or working in the emergency department. So it's been an incredibly cohesive, collaborative effort on the part of our entire team, and I'm both proud and grateful for the professionalism and dedication that our team is providing to our community during these incredibly challenging times.
I feel like every business, everybody in the world has had to change and adapt. And we say a lot is pivot, do things a little bit differently in response to this, right?
You got it, and we're no exception, and we're actually getting to be very, very good at that. And it's because we have excellent team members who understand the need and step up and help us out wherever they can.
We talked earlier about how you made those changes where the routine medical things, the screenings and the testing, a lot of that stuff has been put to the side and put on hold. But what should people do if they think they may have an urgent medical issue, but it's not COVID-19? In other words, maybe it's chest pains or maybe they fell or something like that and injured themselves. What should they do?
Such an important question, Matt. And really, if the situation is life-threatening, they should call 911. If it's an emergent but not life-threatening, an important message for our listeners to hear is that our emergency departments are open. We are treating patients, and we are a safe place to seek care if needed. People should wait. People should not wait for their symptoms to get worse before they engage in a healthcare provider.
Very important, I guess. We want to make sure that we don't have bad things happen to people and they fail to get the attention that they need.
Absolutely, and essential, regardless of COVID or not. That's got to be on the forefront of everyone's mind.
We have seen some terrible times and everything, but we have seen so many great stories, and as we say here with our Everyday Heroes feature, they are really shining brightly in our community. Seen a lot of stuff on social media that the hospitals and EMS teams receive a lot of donations and support from the community. So what are you hearing from them when they get those kind of donations? Does it help? Does it help them feel better? How about the morale?
Absolutely. Our team members are healthcare heroes all the time. But during the COVID crisis, again, they've just stepped up beyond anything we've ever done before, and we've had to. And they've stepped up and just taken the call and answered the call and are doing everything they can to help. And they really do appreciate the community support that we've seen. When we talk about our community engagement, I can't thank our community enough for all that they've done. And I'd like to give some examples. There are businesses in our 5-county region like 3M and Lamont Company in Chestertown, along with several medical, dental, and veterinary practices that have donated really important stuff that we need, like PPE, personal protective equipment, sanitation supplies, and masks. These are things that we need every single day and it's essential that we have a supply on hand. Also, several local quilting and sewing groups have been busy making masks for distribution to our staff and anyone who has to come to the hospital. And as I mentioned, that's a requirement now, so we've got to have that supply on hand to safely move about our facilities. What's also really neat, Matt, is that restaurants, delis, pizza places have all been extremely generous, delivering a variety of meals and treats for staff at all of our hospitals and our emergency centers. So just a few quick examples for the donations. Last week, we received a donation of 1,000 cups of gourmet popcorn from a local company. And also, each hospital's received flower arrangements from a national nursery. There have just been so many meaningful gestures.
Yeah.
For example, too, like signs and banners that are posted at our hospitals, and words of encouragement and support to everyone on our team. And you are absolutely right. These make a significant difference. You know, healthcare workers, again, are heroes every day, but more than ever, SHORE recognizes them and rewards them, and we know that the communities appreciate their efforts and sacrifices, and their support really means a lot to us.
Some of these people, I'm guessing, only, quote unquote, come up for air once every so many hours, and it's nice that they'll get, even if it's only for a few minutes, a decent bite of something to eat, and we do appreciate those places that have donated.
Absolutely, and it fills their soul as well as their body, and that's what's most important this time.
Ken Kozel, CEO of University of Maryland Shore Regional Health, is with us. Ken, if someone has, an idea or a thought, or they are drawn to help out in some way and they want to find out how to do it, what should they do?
We've set up a system at Shore in which our foundations are handling all those donations. So local civic groups, businesses, individuals interested in donating directly to any specific hospital within our system or to our system in general can submit donations to a few different ways. And if you'll allow, for Shore Emergency Center at Queenstown and our Shore Medical Centers at Dorchester and Easton, our contact for those donations is Amy Lowe, and Amy's phone number is 410-822-1000, extension 5763. For the Shore Medical Center at Chestertown, our contact there is Marianne Ruhrman, and Marianne's direct number is 410-810-5660. The need for philanthropic support has reached a new level of urgency. Yeah. So if our audience would like to support our efforts, please consider a gift to the COVID-19 Response Fund. And you can find out more information about that fund on our website, www.umm.org/how-u-can-help. And of course, this most important way to support our hospitals and our care teams is to follow Governor Hogan's guidelines. If you really want to help us out, please stay at home as much as possible, continue your social distancing, wash your hands frequently, and if you must go out, please wear a mask. That's going to be the difference in how we manage this pandemic, not only now, but moving forward in the future.
Ken, if we want to get some more information, what are the various resources that Shore Regional Health has for people, probably a similar kind of stuff online and all that, right?
Yeah, there's a couple of comprehensive ways they can get information, and the first is through our website, umms.org/COVID-19. That's the resource where you'll find an enormous amount of information about COVID-19. Also, regarding possible symptoms or caring for someone at home, there's a 24/7 nurse hotline that we've established to assist our community if needed. And you can reach that hotline by dialing 1-888-713-0711. That's 1-888-713-0711.
Excellent. Well, thanks for taking time. I know you're very busy right now trying to escort see everybody through this crisis as best we can. Ken Kozel, CEO, University of Maryland, Shore Regional Health. God bless. Take care. We'll talk to you soon.
Thank you, Matt. It's been a pleasure, and thank you for all you're doing as well. Keep up the good work.
Thanks a lot. It's 96.7 WCEI. We'll be back. All right, good stuff. Thank you, Ken.
Appreciate it, Matt.
Ken.